Okay, we're now in the Chiropody Clinic with some faculty and some current students. So we can start by asking about what the graduate opportunities are as a chiropodist.
Absolutely. The graduate opportunities, once you graduate from the program, obviously, you have the option of working in a hospital setting or in a community care center, or setting up as a private, in a private clinic as your own practice to be a chiropodist, independent private health practitioner. Yeah. Which is nice. It gives you opportunities to, if you want to work in a healthcare setting where you are an employee versus being an independent business owner and set your own hours. So it gives you flexibility, and there's lots of diversity as to what you can do. You can, sometimes people working, chiropodists working in a hospital setting have they're specialized working in a wound care team. So different teams can be set up within a hospital setting so that you have, open to different opportunities.
So maybe let's backtrack too. So when you talk to your friends and you say you're in a chiropody program, how do you explain it to them? What is a chiropodist?
We tell them that we're a lower limb and foot specialist, and then they usually follow up with, "Oh, do you have a foot fetish or something?" Yeah. We're like, "No, we don't have a foot fetish. We just really like healthcare, and we want to be entrepreneurs, and we just want to treat patients."
Yeah. So, and then you usually tell them, a lot of people, unless if you're seeing a chiropodist or your family members see one, a lot of people aren't. They say, "What's that?" It's chiropody, right? And we kind of give them the whole spiel. We talk about our scope of practice. Sometimes people think we only do orthotics. That's not necessarily true. We can also prescribe medication. We can do soft tissue surgeries. We can do a lot of modalities like shockwave, ultrasound modalities such as that. And also we can do a lot of things that kind of other professions touch on. So I know a lot of chiropractors like to do the taping methods. If a patient doesn't want to purchase orthotics immediately, we can kind of put their foot in such a way where they're kind of getting that support, right? So we see a lot of flat feet too. So that's like a major concern for us. But yeah, so we usually just give that spiel to them and they're like, "Oh, cool." So
while you've been in the program, would you or have you been able to maintain a job outside of the program?
She can answer that.
So, in terms of a full-time job, I don't have a full-time job because that is a lot of hours with addition to studying after school. But I do have a part-time job. I work about 8 to 10 hours a week, so I think that's very doable for a student. But I wouldn't exceed any more than 8 to 10 hours because you do have to study a lot, constantly go over material, and then you have to wake up early.
And we do have lab sessions that are essential because that's our skills, right? We learn didactic theory in class, but lab sessions are truly where we kind of practice everything. So having a full-time job is not really conducive toward that, but at the same time, you can certainly have a part-time job. I don't have one, so I can't really say it, but I know tons of people in our class do.
Well, and that goes into the next question on program delivery and how the curriculum is. How different is it than an undergrad? Lab versus theory.
Right. So you'll definitely have your didactic courses.
So to start with, the class sizes are very small. We take anywhere between 32, went up to 38 students in each cohort. So it's small classroom setting, and labs are even smaller. We have about 1:8 to 1:10 faculty to student ratio.
Yeah.
So it's very much hands-on skills training. So we have didactic courses where we teach anywhere from podiatric medicine courses to biomechanics, dermatology, pharmacology, soft tissue surgery, sports medicine. All those courses are delivered in a didactic setting, but most of these courses also have a lab associated with it. So that's where you have the hands-on practical skills, where you learn with very close supervision from the faculty members. And what's also unique about our program is right from the beginning, pretty much in the second semester, they go right into our teaching clinic. So whatever they have learned in labs and didactically, they actually get to experience it with patients. So these are real live patients. But the clinical curriculum is actually built from second semester onwards, based on their knowledge as well as the skills they have been learning. So first semester they will learn like assessment skills, patient history, things like that. The second semester in clinic, we add on more skills or more expectations and competencies that they need to meet. And as the years go by the time they get to the third year, like those students, they would have had to pretty much work on their own. They're building towards being an independent practitioner. And in the third year, they actually get into private practice externships as well. So they actually get a feel for how it is in the actual world compared to our teaching clinics. So that's how we build the curriculum.
Actually, I would like to add a little bit too, because this is the faculty you're hearing from, and I'm a first-year student, first semester, just beginning and receiving what they're teaching us, right? So I felt, again, the question goes back to what you said, how is it different from undergrad? I think one of the very important, unique things here is it's all integrated. So all the courses they're teaching, I felt it's very unique in the sense that it's focused on the foot. We're all talking about foot or lower limb, and how different subjects is just broken up into different subjects, right? But the anatomy, the pathology, the medicine of it, the dermatology, all are connected. You really feel that once you start the course. Like today, I sit in a course that talks about something about the anatomy. Then the next class is just talking about the pathology of that anatomy, and you really get the sense of how I'm going to apply it. And I believe we're going to get that in the upcoming semesters.
Will progress as you go through the years. It builds and builds, and that's another thing. It's what you learn in first year, you still need as you move into second year, and you will still continue to build on that. So every year builds on the next year.
And I think it's important to note, too, for our audience at home, about how this is the only chiropody program in Canada.
English speaking,
well,
yes.
Yeah, there's a French, Intra-Riviere, pediatric, but this is the only chiropody program in Canada. We have the only clinic, correct? The free clinic?
Yes.
Yeah.
Yes.
Technically.
Free, yes. Unless the patient goes to a hospital or has a wound or has some kind of issue like that, this is technically the only free. And there's CHCs actually, right?
Yeah, there's CCAC. So, but actually having a clinic linked to the education, that's a unique to our program at the Michener, that we have a clinic right within the building linked to our program. So, sort of comprehensive within the building.
Yeah. And so at the end of the program, is there a regulatory exam?
Absolutely, yes. We are a regulated healthcare profession, and so we are governed by or regulated by the College of Chiropodists of Ontario, and there's additional information at that website regarding our scope of practice and whatnot. But there is definitely a registration exam that is written after graduating from this program, and is written within a few months of graduating from the program. Yeah. Is required for practice in Ontario.
The program itself finishes around end of April, beginning of May, and then the registration exam is usually done in June. And the registration exam actually is composed of like the jurisprudence exam, as well as a knowledge-based written exam, as well as an OSCE. That's done by the College of Chiropodists.
And as faculty, you prepare students for all these?
Yeah, absolutely. The program is geared towards what the guidelines are for the college, and so making sure that giving the students the best opportunities to be successful in the registration exam.
You guys enjoying it? You're almost done?
Almost done.
Yeah, almost done.
Well, thanks, Chiropody. Yeah, like she said, you could visit the website for more information on chiropodists, tell your friends about the career, and well, to be continued.